Quad is a really cool partnership that it brings together students from different universities within Colorado Springs and other professionals and professors to tackle these community problems.
In the move to virtual work, we've been really thrilled with how resilient our teams have proven themselves in navigating this remote work situation. And then conversely, on campus, in the community, how many organizations remain committed to working through this with us.
I joined Quad. I was looking for ways to become more involved in the Colorado Springs community and kind of break out of this CC bubble. And so that's how I found out about Quad. I was talking to people at the Career Center and they recommended looking into it. I've always been interested in education, but being able to kind of work on a project that's creating deliverable for Children's Hospital and centered around education kind of at a more professional level has been a great experience for me. I found out that I really love working on kind of like the short project-based approaches to work. So like being like, kind of like the block plan, but just like translating that to the professional world and having to like disseminate information really quickly and put together a report in a relatively short amount of time with a new group of people that you met. I love doing that.
There's no rubric on these projects. We don't know what success looks like when they start. The students are kind of in the driver's seat, navigating what their client needs, what their client wants, trying to understand the nuances of, yes, there's a scope, but understandings evolve. There's many people involved in the project. So what does success look like is really something the students have to define, and then they have to deliver it.
So now we are looking at specifically peer-to-peer models of suicide intervention plans within schools. This is really engaging the students with the other students is the goal of a peer-to-peer model. So looking at something that's actually been used in a lot of veteran communities for individuals who have shown that they are at risk for suicidal ideations, called Caring Contacts. It is a kind of longitudinal letter writing campaign where individuals receive letters showing kind of support throughout the time that they're struggling with their mental health. So we've been looking at how to administer Caring Contacts via text messages, knowing that for the time being that they are not able to be around their social network in schools. And then we are actually looking at models kind of peer teams with team leaders to be able to talk about mental health. And really our goal is to be able to give the hospital something that they could give to schools, and schools would understand then how to implement these and understand the feasibility measures involved.
I've taken a very circuitous route in terms of career aspirations. And part of the reason I was so interested in joining Quad was because I wanted to know more about what sort of careers are out there before I jump right in. And now I'm hopeful to pursue a master's in public health because of Quad.